Hello.
Hi.
So other thing, many of children will have that habit during exams or something important. They sit and read in buses, autos, moving vehicles.
Moving vehicles.
Yeah. How does that affect?
So I mean, the real visual impact of this has not been studied. Frankly,
Okay.
the only thing that we are worried about is motion sickness. Of course, there are some children where seeing objects is going to trigger nausea by triggering your inner ear, and therefore nausea. Many of these children, when they get down from bus after reading, they go to school, and then there is that first breakfast which is served in the school, and there they vomit.
Okay.
That is because of constant visual stimulus. And another thing is, yes, the lighting is not going to be that great sitting inside the bus, so it's not a great way. And plus they lose out on social interactions. As you're seeing now as a parent, interaction socially within children is lost. They're all on their screens, they're all inside their own worlds, and they interact also only through WhatsApp or through a chatting medium. So social interaction is very, very important for the child's development. So I always tell my patients also that look out of your screens and see what is around. And once you start seeing, it will be so fascinating that you don't want to look into your screen. So as parents and children, I think everybody should be practicing that.
So how is myopia treated?
Yeah, so myopia treatment is glasses, or if the child is a little elder and is in active sports, then we can also give contact lenses. Contact lenses can be started from 10 years and above. The child is able to manage, handle. We have fantastic contact lenses which are daily disposable ones, or you just use it for that day and dispose. You have a function. The child really, now young girls want to dress up, so using contact lenses is also an option. Also now we have something known as overnight contact lenses. Now this contact lenses is basically to be worn throughout the night. And how it works is it reshapes the eye at night, and so the day the child does not need any glasses or contacts.
Okay.
So another benefit is it prevents or it slows down the progression of myopia also. So it works in a double-edged thing where you have overnight lenses on for the child. Normally you would have heard contact lenses don't sleep with them. Yeah, that is for general contact lenses.
Okay.
But these contact lenses are designed in such a way that it turns your eye, it pushes the cornea a little bit. So it reshapes the eye in such a way that day your eye is perfectly good 6x6 vision, and it will slow down your myopia from worsening also. The second thing that is done in myopia care now is what we do is known as myopia prevention program. So how we measure the axial length of the eye, we check certain parameters called accommodation. When you look at near, your muscles contract, and that is known as accommodation. And this accommodation reserves are different for each of us. So if the accommodation is lax, or if the ability, or if the child is over accommodating while reading, those can change how your myopia can progress. So we act on that. We use certain eye drops called low dose atropine eye drops. Now these drops are scientifically studied and very, very safe, and they can be used every night, and it prevents the myopia from worsening. And there is also now myopia controlled glasses which are available, which works on a special design to prevent your eyeball from getting elongated every year. And therefore these glasses are very normal looking glasses. They look fantastic, but they work in a double thing, that they give you good vision and they also prevent progression of myopia. So that's what we have now in our basket since a decade. Myopia control is a very, very important topic, and when evaluated properly and treated properly, we can prevent myopia from worsening. Because Manasa, the main thing is when myopia worsens, or when your child's power is more than -5 or 6, the eyeball is stretched, the retina is weak. Throughout the life, there are chances of cataract early, glaucoma early, and also retina can develop holes, tears, detachments. So we want every child to prevent high myopia. And high myopia is right now a huge burden globally. By 2050, they are suspecting 50% of our population to become myopic. Right now, 1 in 4 children is having myopia. So if we diagnose early and prevent progression, we prevent problems from happening, and the global economic burden of these diseases comes down. So it is a great important thing to identify.
So is it lifelong process? Like you need to wear them how long? Is there any duration?
Yes. So yes, till glasses right now, till 18 years of age, you have to wear glasses. And if the powers are stable by 18 or 20 years of age, then we can go for refractive surgeries like LASIK or ICL or excimer laser, PRK procedures. There are a lot of procedures available. So beyond 20, 21 years of age, if the eyeball growth has stopped and your number is not worsening, we can definitely go for these refractive surgeries. But please understand that your retina doesn't change. Whatever the number, you can take it off with a laser treatment. But the weakening of the eye, which has happened all these years, that does not go off. Therefore, keeping your numbers as low as possible is beneficial. Lower numbers are easily operated by LASIK. That's a permanent cure, and the retina is also not weak. So it's a win-win situation to change your lifestyle.
True. So, ma'am, myopia can be prevented.
Yes, some types of myopia can be, in the sense that we see, especially in preteens. I would say that from the age of 10, if lifestyle is maintained a little bit well, myopia can be prevented. Now, another thing here important to understand is genetics. We see that if two parents are myopic or have been myopic earlier in life, there is a literally 40% chance of their child getting myopia. So if genetics catches up, you can't do anything. But if the parents have had great vision, grandparents have had great vision, then the lifestyle is the number one cause for causing myopia. And therefore, getting the children involved in good outdoor activities and less of screens, having balanced diets is very, very important.
So the genetic plays a key role.
Genetics is
In
very
myopia.
important in myopia, as well as all other refractive errors. If the father's eye is shorter, the child's eye can be shorter and they can get hypermetropia. Or if the shape of the eyes runs in generation. And also, genetics is also important in siblings. Many a times the parents don't have anything, but the first child has had myopia. There is a lot of risk that the second child will also have the same eye design, and they turn out to be myopic. Many a times in my clinic, I have a parent bringing only one child, but the second child has come along. I have a habit of always checking that second one. I tell them it's a free service, let me check. And I've detected more times than I can expect, like many a times, that the second sibling has actually much more eyesight than this one. But the sibling is smaller, so can't complain, doesn't know how to verbalize it, and therefore goes undetected till they develop a problem. So siblings should always be evaluated together for an eye checkup. That is also very much important.